Hi, my name is Brad Diamond. Today we're going to do a head-to-toe assessment on patient BD. Sir, do you give me permission for purposes of grading to record this to submit it to Pensacola State College Nursing Department? Yes. Good. Thank you. We'll go ahead and I'll get my hands washed and we'll get started. Okay, we can start out if you will. If you don't mind, tell me how much do you weigh?
159 pounds.
Right, and how tall are you?
About 5'7".
Right. That's all right. I'll make notes. And that appears to be within normal limits. If you don't mind, we're going to go ahead and we're going to test your visual acuity. So if you don't mind coming around here, we're going to stand approximately 20 feet away from this, and we're going to use that to cover up your eyes. Have an eye chart over here. Just back up just a little bit. Great. If you don't mind, read all the way from the top down to until you can't see any further. Cover your left eye first.
We're going to go with E, F, P, T, O, Z, P, D, C, L, P, E, D, P, E, C, F, D, E, D, F, O, C, C, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
Right. You cover your right eye, please. And again, from the top to the bottom.
E, F, P, T, O, Z, P, D, C, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
Great. Great, you can have a seat. Do you wear any corrective lenses or anything like that? Yeah. So the patient's vision, visual acuity is going to be 20/20 bilaterally with no corrective lenses in place. We're going to start from here. Here, I'll take that, sorry. And we're going to just check some vital signs. We're going to check your heart rate first. Your heart rate's 70 and you're breathing about 14 times a minute. Next, we're going to check your blood pressure. Sorry, I'm just making some notes over here. We're going to check your blood pressure first on your right arm, and then we're going to do the left as well. Feel a tight squeeze here, I know. Sorry. Try this again. Tight squeeze. Blood pressure in your right arm is 124/8. Just gotta make some notes. And then on your Again, you're going to feel a tight squeeze, okay? Pressure in your left arm is 123 over here. Check your temperature. Have you been running any fevers of any kind or anything like that? Good, 98.0. Are you in any pain right now? Anything that we need to assess any further before we get started on anything else? Yeah. So if you'll give me your hands, we're going to look at your hands, looking at your hands and nails for any kind of abnormalities or issues going on there. The patient's skin color and pigmentation appear normal for his genetic background with the occasional freckle. The skin temperature is warm with a smooth, even surface bilaterally. There are no signs of dehydration or diaphoresis noted as well. The skin turgor is good. Skin returns to place and promptly when released and returns to place in less than 2 seconds. Next, we're going to assess the patient's skull and face. You know, tell me, pressing on your head, press on your face. You let me know if there's any tenderness or anything like that. Okay. Hurt anywhere in here? Yeah. Still fine. And open your jaw for me. And can you turn it from side to side? Any pain or tenderness when you do that? Okay. You close your mouth. Okay. So now press on your. Any pain?
Yeah.
Any pain here? Good. Alright, if you will, if you'll raise your eyebrows real big for me, good. And you can relax, smile, and stick your tongue out. Great. Alright. Now if you go feel your cheeks over there. The cranium and skull, the cranium is normocephalic and with a scalp with a smooth, even surface with no lesions present. The patient's facial muscles are intact and symmetric. The patient's temporal artery is palpable and strong bilaterally. The temporomandibular joint is noted to have smooth movement with no limitations or pain or tenderness upon palpation. The patient reports no tenderness of the sinuses upon palpation. Next, we're going to assess the cranial nerve number 2 by confrontation test. Sir, if you will, I want you to stand up for me, please. I want you to take this card here, and from here, I want you to cover your right eye. I'm going to cover mine, and whenever you see my finger come into your visual field, I just want you to say now, okay? Good. All right. We'll come from the other side. Good. All right. The patient's visual fields are within normal limits. The peripheral vision is intact by confrontation. Now we're going to assess the patient's extraocular muscles. All right. If you will, I want you to stare straight at me. All right, moving your eyes only. I want you to follow my finger, okay? I'm going to shine a line in your eyes, okay? Just look straight at me. The patient's extraocular muscles are intact with and within normal limits. The pupils are equal and reactive, responsive to light. The corneal reflex appears within normal limits, and the reflection is on the same spot on bilaterally. The external structures of the eyes are within normal limits. The eyebrows are present and move symmetrically with no scaling or lesions noted. Next, we're going to assess the patient's conjunctiva and the sclera as well. If you will, why don't you just look up for me? All right. I'm sorry, just got to shine light in your eyes. The conjunctiva and sclera appear within normal limits with and with normal color. There's no swelling or lesions noted. And the patient's corneas are clear. The iris appears flat with round and regular shape and even coloration. The pupils are 4 millimeters bilaterally with normal response to light. Next, we're going to use the ophthalmoscope to look within the patient's eyes. There'll be another light in your eyes, okay? Just look straight at me. You got me? Sorry. The red light reflex is present bilaterally. The discs are flat with sharp margins. The vessels are noted to be present in all quadrants. The retinal background appears normal with no signs of hemorrhage or exudate. Next, we're going to move on and assess the patient's ears. Again, I'm just going to palpate on your ears and let you know if there's any tenderness or anything like that. Okay? Does this hurt anywhere at all? Okay. All right. I'm going to go ahead and look inside of your ears. You've been having any trouble with your ears at all or anything like that? No. Let's go a little closer. Turn your head that way just a little bit. This way. The external structure of the ears are equal sized bilaterally with no tenderness upon palpation, no swelling or thickness noted as well, and the patient does not complain of any discharge. No discharge was noted upon exam. Within the ear canal itself, there was no redness, swelling, no lesions or foreign bodies or discharge noted. The tympanic membrane was intact, pearl gray in color, shiny and translucent. Next, we're going to test the patient's hearing. All right, first I just want you to sit there and I'm just going to speak like that. Can you hear me? Okay, good. We're going to do a test with this, it's called a tuning fork, okay? We're going to do what's called the Weber test and the Ryan test, okay? I just want you to let me know when you can hear him whenever it stops, okay? Stop. Okay, good. Was it equal on both sides, or was it one side or the other? Equal on both sides? Good. Next I'm going to do it, and we're going to put it behind your ear, okay? Tell me whenever it stops, let me know. Can you still hear? Same on the other side. Let me know when it stops. Okay. Still here? Good. Whispered words were heard bilaterally. The Weber test was heard midline without lateralization, and the Ryan test was positive. Next, we're going to assess the patient's nose. Any pain or tenderness whenever I touch? Any problems breathing through your nose or anything like that? I'm going to look in your nose, okay? Okay. Look up. The patient's external structure of the nose is symmetric and midline. There's no deformity, inflammation, or skin lesions present. In the nose itself, the nares are patent, no obstruction. No obstruction was present. The nasal mucosa is normal and red in color, with no swelling or discharge or bleeding noted. The septum is intact, with no deviation or perforation. The turbinates are normal red in color. Next, we're going to move on and assess the patient's mouth. Okay, sir. Alright, stick your tongue out for me. And say ah. Great. The patient is able to clench his teeth. The teeth are white, straight line, and clean of any decay or debris. The gums are pink, with no signs of swelling or bleeding noted. The tongue is pink with no signs of any lesions present, normal in color as well. The tonsils were graded at a 1+. Swallowing was intact, and the uvula rises normally on phonation. The tongue protrudes midline with no tremors present. Next, we're going to move on and assess the patient's neck. Alright, I'm just going to press on your neck a little bit. Okay, let me know if you feel any pain or tenderness anywhere. Okay. Any pain when I press? Just feeling for any lymph nodes, swelling, or any lymph nodes or anything like that. Pulse. Shrug your shoulders for me. Great. And move your head side to side. Great. The neck appears within normal limits. The head is held erect and midline, with no obvious lumps or pulsations present. The cervical lymph nodes are palpable and movable. They are soft, discrete, and non-tender. The carotid pulse is palpable and present strong and regular bilaterally, and the trachea is midline. The patient has full range of motion in his neck. The shoulder shrug and the head movement are intact and equal bilaterally. Now I'm going to move behind the patient and try to assess his stomach. Press, let me know if you have any tenderness or anything, okay? The thyroid gland was non-palpable with no enlargement noted. Staying behind the patient, we're now going to assess the thorax and the patient's lungs. So you're going to feel me press on you a little bit here, and I'm going to press and I'm going to tap a little bit, and then I'm going to listen to your lungs, okay? You let me know if there's any pain or tenderness anywhere, okay? Any pain when I'm pressing at all?
No.
Alright, if you will, say 99.
99.
And blue moon?
Blue moon.
Good. Alright, good. Now I'm going to be doing some tapping on your back, okay? Sorry. Okay. Now if you will, exhale and hold it. And inhale and hold it. Any pain or tenderness at all?
No.
Relax. Good. The patient's thoracic configuration is in a normal elliptical shape. The skin is intact and smooth and with even surfaces. The thorax rises and falls symmetrically with breathing. There were palpable vibrations noted with when doing testing for tactile firmaments. No lumps or tenderness were present upon palpation, and percussion over the lung fields. Noted resonance as the predominant tone. The diaphragmatic excursion was approximately 5 centimeters, and the patient's spinous processes appear straight and within normal limits. Breath sounds were clear and equal bilaterally with no adventitious sounds noted. Now we're going to move back to the front of the patient and assess his that anterior aspect of his chest and lungs. Again, so you're going to feel me pressing on you, tapping on you a little bit, and I'm going to listen to you as well. Okay. Let me know if there's any pain. No pain. Here. Just going to tap on you a little bit. Okay. Deep breath. Good. The patient's respirations are equal and non-labored. The skin is intact, smooth with even surfaces. No redness or lesions noted. Tactile firmament is present on palpation, and there were no tenderness or lumps. Resonance is noted as a predominant note across the lung fields on percussion, and the breath sounds were clear and equal bilaterally with no adventitious sounds. Next, we're going to move on and we're going to assess the patient's upper extremities. Sir, if you will, you stand up for me. And if you will, we're going to raise your arms up to the ceiling. All right, and back. And back as high up as you can, and cross your arms behind. Any pain or tenderness at all when you do this? Good. And from here, we want arms down by your side, and I want to raise your arms up until your palms meet over your head, and put your hands behind your head. Any pain or tenderness at all? Okay, if you will, give me your hand, please, sir. Right now, just feeling for any swollen lymph nodes. Now, with both your arms, I want you to kind of flex your elbows up. Good, and extend. Great. Now, if you can, I want you to what's called pronate your wrist and bring them in, and bring them back out. Any pain or tenderness at all when you do that. All right. Spread your fingers out for me. Make a fist. Great. Squeeze your fingers. Squeeze my fingers. Sorry. Squeeze my fingers tight. All right. Pull me towards you. Push me away. Good. All right. The patient has full range of motion in the upper extremities with smooth movement and no tenderness noted. The epitrochlear nodes were non-palpable. At this point, if you will, sir, if you'll lay flat for me right now. Okay. We're going to leave you covered just for privacy reasons, but we're going to say that everything was within normal limits. The breast, the supraclavicular, and the infraclavicular areas are within normal limits. The breast exam was deferred due to privacy reasons, but if all was within normal limits, I would expect there to be no lumps or tenderness upon palpation. The nipples to have no swelling or lesions or no cracks noted with no discharge as well. The patient's axilla would reveal no swelling or no tenderness at either. Sorry, now we're going to move on and we're going to assess the patient's jugular venous pulse. I'm going to lay your bed flat, okay? Right now I'm just kind of looking at your neck, and when I say you're laying flat, we should see. I'm going to move that pillow up as well. Thank you, sir. Okay. Okay. The jugular venous pulse is within normal limits. It's present when the patient is lying flat, but disappears when the patient is raised to a 45-degree position, which is within normal limits. Now we're going to move on and we're going to assess the patient's heart. Again, you're going to feel me pressing on your chest, and then I'm going to listen to your heart sounds, okay? Let me know if there's anything, of course. Just trying to feel for your heart. When assessing the precordium of the patient, no pulsations were noted. The apical pulse was not palpable, but the apical heart rate was 64 beats per minute with a regular rhythm. The heart sounds were normal with no adventitious sounds or murmurs noted. Moving on, we're going to assess the patient's abdomen. So if you will, I want to raise your gown up just enough where I can see your abdomen, but if you'll bring your knees up a little bit so you can relax. Yeah, it'll help relax your abdomen. I'm going to lay you a bit flat. Okay? I'm going to listen to your abdomen first, okay? I'm going to kind of tap on your abdomen here. Let me know if that hurts or anything. Try to relax your belly. You're going to feel me press kind of hard on you, okay? Let me know if it hurts. Now, take a deep breath in. Hold it. Try to relax as best you can. Okay. Relax. Okay. Now again, take a deep breath. Relax. No. Just feel your kidneys now, okay? Take that. Breathe. Good. Breathe in. Okay. Your other side. Good. Just feel and see if everything. Any pain or anything whenever I do that at all? Good. The abdomen appears within normal limits. The abdomen itself is flat and symmetric bilaterally with no obvious bulging masses or pulsations noted. The skin surface is smooth and even with no scars or lesions present as well. Bowel sounds are noted in all four quadrants with no vascular sounds noted. The percussion revealed general tympany present in all four quadrants. The liver and spleen were not palpable, and the kidneys had no change upon inhalation. The aorta was palpable with pulsation in the anterior direction with no widening noted. At this time, the femoral pulse and the inguinal nodes will be deferred due to privacy reasons, but if all within normal limits, I would expect there to be a strong, equal femoral pulse bilaterally, and the inguinal nodes to be soft, discrete, and movable. At this time, we're going to assess the patient's lower extremities. I'm going to kind of palpate your legs and let me know if anything hurts, okay? I'm just going to assess your pulses. Any pain or anything here? The lower extremities appear equal and symmetric bilaterally. The skin is intact with no lesions present, with normal hair distribution noted as well. All pulses are present and equal bilaterally, including the popliteal, posterior tibial, and dorsalis pedis pulses. The skin is warm to touch, with no edema noted. The toes point straight and lie flat. At this point, we're going to test the patient's range of motion. If you don't mind, we're going to sit up. Okay. Oh, I'm sorry. Actually, we're not. Lay flat. Okay. If you'll take your right leg and you'll raise it up at a 90 degree, at a 90 degree motion. Great. And if you'll bend your leg, great. Any pain or tenderness when you do this all? I want you to rotate your leg in and then out. Great. Any pain or tenderness noted at all? Great. Now straighten your leg out, and I want you to bring it out and back in. No pain or tenderness. Right? All right, we're going to do the same thing with the other leg. If you can raise it up to a 90 degree angle and bend your leg at the knee, rotate it in and rotate it back out. Straighten the leg out for me and bring it out towards me and back in. Any pain, anything like that? Good. If you will now, press down on my hands like you're pointing up towards your nose. If you got any pain or anything like that. Can you fan your toes out and then clench your toes? Great. Patient has full range of motion in his hips, knees, ankles, and feet, and there's no tenderness noted at all. Then now we're going to assess the patient's sensation. Yeah, you can sit up for just a little bit. I'm sorry. No, lie flat. We're going to sit you up in the back. Give your pillow back and relax. Okay. Okay. Now, if you will, I want you to close your eyes. Okay. I just want you to say now whenever you feel tension. Okay. Everything feel the same on both sides? Good. Keep your eyes closed for me. I want you to tell me which direction I'm moving your finger.
Down.
Okay. Now I'm going to keep your eyes closed for me. I'm going to place an item in your hand and I want you to tell me what it is. Good. Good. You can open your eyes. Okay. And if you will for me, I want you to take your right finger and touch my finger and touch your nose. Touch my finger, touch your nose. And we'll do the same thing on the other side. Touch my finger, touch your nose, touch my finger, touch your nose. Now, with your heels, I want you to take your right heel and I want to run it up and down your right. And do the same thing on the other side. Good. Now we're going to assess your reflexes, okay? If you don't mind, why don't you kind of sit off the side of the bed for me, okay? Take your arm, okay? I'm going to assess your biceps reflex first, okay? Good. Alright, from here I want you to take your arm and I want you to just let your arm relax, just kind of dead weight here, okay? And I'm going to tap on the back of your arm here. Relax your arm. Good. Alright, from here we're going to, give me your thumbs. Okay. Now come down to your level just a little bit. Thumbs here. Just let your legs dangle. Don't put any weight on them. Get back behind your leg here. Good reflexes. Now we're going to test your Achilles. If you don't mind, you think you might be able to just lay up on the bed for me? And then we'll test your Achilles. I'm going to rotate your leg out just a little bit, okay? Good. Push your leg out. Good. Oh, sorry. Now we're going to do your attachment. The sensation of the patient's face, arms, hands, legs, and feet are all intact bilaterally. The position sense is intact as well as the stereognosis with this patient successfully identifying a pin. The cerebellar function of finger to nose as well as heel to shin are smooth and accurate. The deep tendon reflexes, including the biceps, the triceps, the brachioradialis, patellar, and the Achilles, are all intact and greater than a 2+. And the Babinski reflex was negative. Next, we're going to test the patient's movement across the room. You feel have a stand up for me? Now we're going to have you walk across the room. First, normally, I want you to walk normal this way, and then on your way back to me, I want you to walk heel to toe. Good, okay? Heel to toe. No. Like in a line. Heel to toe.
Oh, that heel to toe.
Yes, sir. And then on your way back, heel to toe for me, okay?
I didn't know mine.
Good. Sorry.
That heel to toe.
Sorry.
You're fine.
And then now, whenever you walk back down again, I want you to walk on your tiptoes, and on your way back, walk on your heels, okay? Okay, you stop, okay? And if you will, close your eyes for me and hands down by your side, okay? And then now you can open your eyes for me, okay? If you want to, now I want you to stand on one foot, okay? And with the other leg, I want you to do like a shallow knee bend, okay? Good. And we'll do the opposite side. Okay. Any problems with that at all? Okay. You can have a seat. The patient is ambulatory with a steady gait, walking in a straight, balanced, and able to maintain posture. And go do one more thing for me, okay? I'm very sorry. If you'll bend over and touch your toes. Good. Stand back up. Okay, no, don't sit down just yet. Sorry. If you'll turn this way, okay? I'm going to stabilize your waist, and I want you to turn sideways. Good, and turn the other way. To come back towards me just a little bit. Very good. And turn your shoulders to the left. Turn your shoulders to the right. Very good. The patient demonstrates normal position sense and has full range of motion of the spine. At this time, we're going to defer the exam of the patient's male genitalia and the rectal exam for patient privacy. As the patient stated, everything was within normal limits and no lumps or lesions or masses were palpated. And there was no discharge as well. At this point, we're going to teach the patient how to do a self-testicular exam. We should do that normally on a normal basis, but remember that when you're in the shower at least once a month, when the scrotum is a little bit more relaxed than usual and everything, we're going to palpate our testicles to make sure that we don't feel anything abnormal from the time before, no lumps or masses or anything like that, okay? All right. At this time, I'd like to thank patient PD for his volunteering for me, and that completes our HeadtoToe assessment.